So, Dr. Selby, tell me what led you to become a psychologist and then a psychology professor? What was that path like?
It was a very unusual path. When I was back in college in my early 20s, I actually became a registered nurse
Oh,
and was miserable. It's a special calling, and I didn't get that calling. And so I went back to school, got a degree in fashion merchandising. I tried to find something as far away from nursing as possible, and opened a store. And while I had that store, I got really sick, and it was kind of like a rude awakening. And so I ended up closing down the store and dealing with the illness, and decided to go back and get a master's degree, because while I was running the store, I was invited to teach at both Chico State and Butte College. And I've always been a person who, if a door opens, why don't you walk through it and see what's on the other side? And so I didn't seek out being a teacher, but teaching found me, and I fell in love with it. So when I dealt with this illness and was kind of reevaluating, I thought, well, I'm going to go back and get a master's degree. I didn't choose to get a master's degree in psychology, but the very first class that I was suggested to take was a research methods class, and the one that was available was in the psych department. And I actually found myself being so totally interested with the cases that were in the textbook. Yes, the textbook led me here. And I thought, I think I'm going to take a few psychology classes, and fell in love with it. And as soon as I got my master's degree, I knew I wanted to be in the classroom. So I graduated in May and found myself in a classroom in August here at Chico State. Then decided to go on and get my Ph.D. because I saw that as a lecturer, I was never going to be tenure track, because I was in my late 30s at that point, having children. And I thought, in order to have some measure of job security, I'll go get a PhD. So I did that. And before I finished with the PhD, I was again offered a position at Chico State, and have loved it and been there. And hopefully in the next few years, I'll be retiring. But the area that I focus on, since I am clinical psychology, is I teach the abnormal psychology course, and I also teach the intro course. And I love that because I love introducing kids to this discipline, because it is so highly interesting. And anyway, so that's kind of how I ended up where I ended up. It was a very circuitous route.
yes, I'll say fashion, nursing, psychology. So when you started your master's program, what were you intending to get your master's in? What subject?
Yeah, I was self-writing it. Thought I was going to do more in the business retail kind of end of things that I'd learned in my fashion merchandising bachelor's degree. But again, that first class I took, it grabbed me. That the whole field of psychology grabbed me, and I knew I had found where I was meant to be. And I never looked back, and have been so incredibly happy and really quite blessed, and I just chose to take advantage of the opportunities that, presented themselves. And I never wanted to be a tenure track, because I didn't want to take on the additional duties. I wanted to be in the classroom with students. So that's what I did.
How is being a clinical psychologist different than being a marriage and family therapist? What can you do that a master's degree therapist can't?
Well, the focus is a little more heavily on the assessment part, where as a PhD, working clinically, you're trained to, do various assessments that a marriage family therapist isn't. There's more opportunity in inpatient kinds of settings than a marriage family therapist. And so that's really the main difference. I never chose to get licensed because I knew I wanted to be in the classroom. I didn't want to be doing, individual or couples or whatever therapy in a private practice. And before I made that decision, I had to make a decision about, well, do I want to get licensed as a PhD, or do I want to get licensed as a marriage family therapist? Because you can do that. Just because you have a PhD doesn't mean you're forced into getting a license as a PhD. I actually, if I decided to go forward with getting licensure, I probably would have gone for the MFT license over the PhD, just because of the kind of, individuals I wanted to work with and the kinds of problems I wanted to work with. I felt that an MFT license was a better fit. People with PhDs tend to work with more clinically based kinds of issues. They're going to be dealing with individuals who probably are also going to be having to see a psychiatrist for drug management, those kinds of things. And I didn't really want to work with that population. I was much more interested in helping people adjust to and learn to live with the various challenges in their life, challenges in various relationships, those kinds of things. And so that would have been a better fit. And thankfully, I never had to make these.
Where did you get your PhD, and how did you balance that with your family responsibilities? Because they're both huge.
Yeah. No, I had to get creative. I knew that I could not apply to a traditional PhD program and relocate. I had two very young children. I actually had my children while I was in my master's program. And my husband had a dental practice here in town, and he wasn't going to pick up stakes. And so I chose to go to Saybrook Institute. I think they call it now Saybrook Research Center and Graduate School. It's based out of San Francisco. And I was kind of surprised when I got there. I was surprised by the level of credibility that the professors had. I mean, I worked with Carl Rogers' daughter, Natalie. She was on the faculty there. Carl Rogers, if you don't know about him, he's one of the major contributors to the field of counseling psychology. The head of my dissertation committee was Stephen Pritzker. He actually was, before he got his PhD, he was the head writer for the Mary Tyler Moore Show. Another person that I worked closely with was Ruth Richards. She has her medical degree from Stanford. I swear to God, from Stanford, and then she has her PhD from Harvard. I mean, these are really high-powered individuals, and I was shocked when I got there because I was just basically taking whatever was available to me. So I got my degree at Saybrook, and I guess that's all I need to say about that.
What did you write your dissertation about? What was your dissertation topic?
Actually, and it's funny because it's how I landed at Chico State teaching again. I was very interested in the construct of creativity, and I always believed that every one of us are in the process of creating our own lives, and there's tremendous power in that viewpoint. And so I got into studying the creative process, and so I believe that psychotherapy is in fact a creative process. So I contacted my old professors at Chico State who teach the marriage family therapy students and got permission to gain access to their therapy tapes. And I took a year to gather the data, transcribe the data, analyze the data, and ended up coming up with a model known as the psychotherapeutic process, creative process, and was later invited to publish in the Encyclopedia of Creativity. So if anybody ever wants to check that out, you're more than welcome to. But that was my main focus, was this marriage of creativity and the process of psychotherapy.
So does that mean that the therapist adapts different tools, techniques, outreach to fit the client, or how do you apply creativity to a therapeutic process?
I think that the more successful outcomes occurred with therapists who tended to be far more adaptable and creative to, whatever was coming at them. But also I saw the process as being inherently creative and helping clients to understand that. And it's a very empowering kind of approach to the process of psychotherapy. I found, because I did work for 2 years under supervision of a Ph.D., counseling individuals. And I was really struck by how many of the people coming and seeking therapy had this position of being very passive. And, what do you want? What should I do here? And it was a constant push-pull kind of struggle, trying to get them to understand that, wait a minute, this is your life, not mine. These are your decisions to make. I'm simply here as an individual to kind of guide you and support you to find your own answers. I don't have your answers for you. You have your own answers, and I'm just simply here to help you discover that. And it was only when we got over that hump that I started really seeing true movement and change in my clients. And so it really is part of every part of the process. And as long as I think therapists kind of approach it in that way, I think they're going to end up being far more successful with their clients.
Chico State, at least at its inceptions in the teaching therapist, really emphasized active listening. Kharkov, sounds like you're feeling da-da-da. How are you feeling? How are you feeling? I hear you feeling. And so the therapist didn't do a lot except reflect back for the client's feelings. But sometimes it seems to me people need to be confronted or guided in some way that they didn't think about.
Absolutely. Well, it was Carl Rogers who really was the one that came up with the understanding that by creating a therapeutic environment that, hold on one second, honey, I'm in the middle here, that by creating a therapeutic environment that encourages active listening as well as genuineness as well as empathy, that's the kind of environment in which true change, growth can occur. And so Chico State's, yeah, I know they use the Kharkov method, and I think it's good. It's kind of like when you're learning how to play the piano, you have to learn the scales kind of a thing. It's a good model to it's a jumping off point. But I used to actually teach the intro to counseling class that used that model. And my concern about that was it is kind of a crutch that students would kind of lean on too heavily, and they weren't growing as therapists themselves. So, I had to work really hard during the few years that I did teach that class was to help them see that this is just a jumping off point. This is not the end-all and be-all. What's most important is that you bring those qualities of empathy, genuineness, and active listening. It's through the process of being heard and understood that true healing occurs. And so that's what I think, well, it's not just my opinion. Research has shown over and over again that those are the main elements that need to be brought to a therapeutic setting to really make some changes.
Has your family benefited from your learning in this area? I mean, do you think that you're a more empathetic, caring parent and spouse because of your background?
No, I think all that goes out the window when you become a mother. You know what I'm saying? I mean, my kids didn't want a therapist. They wanted a mother. And so I had to work really hard because there were a few times when that would kind of get thrown into my face that, don't try to be a therapist. And it's like, I'm not. I'm your mother. So I had to be really mindful of that. Because when people hear that you have that kind of training, they all of a sudden all these assumptions that they carry about that get kind of projected onto you. And so I have to be really mindful of that. And, I'm just a human being trying to figure out how to get through this world just like you.
To switch to the news, there's a lot of talk about narcissism and being a sociopath or psychopath in terms of some of our leaders. Could you explain what that means? What does it mean if you have someone present and you think, these are narcissistic patterns? And once you figure that out, how does one help the person transcend those qualities?
Well, narcissism is one quality of a sociopath. it doesn't mean that if someone is narcissistic, they're automatically a sociopath. I haven't really worked with that population. I do think that there's a lot more narcissism inherent in our culture, given all of the social media, and there's a lot of misunderstandings that the way to get feel good is through this kind of external validation by vis-a-vis likes, shares, that kind of a thing. But that doesn't necessarily mean that we're growing more sociopaths. So, I just know in very broad general terms about the various characteristics of a sociopath. But one thing I do know is that narcissism is just one aspect of being a sociopath. There's other qualities such as lack of empathy. I'm sure that there are, definitely a lack of attachment to others, which, attachment is that natural kind of inborn tendency to try to emotionally bond with each other, and that quality seems to be lacking in sociopaths. Of course, there's also biology behind that as well. We do brain scans of individuals who are classified as psychopaths, and in their frontal lobe, which is, of course, the seat of reasoning and judgment and all of that, there's lower activity, but we don't know whether or not it's kind of a chicken or egg kind of thing. Is a sociopath born, or is it bred? I mean, I shouldn't say bred, but raised to become one. I don't know. I really don't have much more to kind of illuminate on that whole topic.
Does sociopath and psychopath, are they interchangeable terms, or are they different?
I think people who are experts in that particular area, there may be some fine differences between those two terminologies, but I think the lay public, for the most part, tends to use those terms interchangeably. But I don't know who you arranged to talk with about the more personality disordered piece of all this, and they would be a perfect person to kind of ask whether or not there's some fine differences between those two terms.
In terms of the pandemic, people have talked about a possible pandemic of depression because people are isolated, anxious, afraid. What's your take as a psychologist on the mental health implications of being isolated and afraid?
Well, I'm just as isolated as all the rest of them, so I just have to kind of share with you my impressions just based upon my limited observations. And really what I've seen is a whole range, from some who just are totally not fazed by it all, and actually sometimes engaging in really dangerous social behaviors, all the way to extreme anxiety, panic attacks, those kinds, and then everybody else kind of in between. And it really does kind of depend on particular circumstances. For example, I've seen, I follow a whole different range of people on Instagram, and probably the population I'm struck the most by is by these young mothers who also have careers outside the home, and now all of a sudden, many of them are working remotely from home, and they have anywhere from 1 to 3 to 4 kids, but now they have the responsibility for homeschooling in addition to carrying on their activities at their job. Quite frankly, I don't know how they're holding up. But what I have been observing, and it's a beautiful thing, is they're connecting up. A lot of them are using Zoom. They're connecting up in the evenings and kind of commiserating with each other. I've kind of popped into a couple of these meetings, even though I'm this old lady who's just likes to sit back and observe how these young women, who I just think are absolutely amazing, are handling it. You can see the level of anxiety. And one person in particular I've been really struck with. This young woman, she does her work from home. She has a national radio show, and she has these 2 kids that now she's having to homeschool, and she already has a kind of predilection for anxiety anyway. And to see how she has gone from being abject panic and talking freely about that, slowly using these social support systems that are kind of organically forming, and all of a sudden she's coming up with these really creative solutions to her problem, and I see her slowly taking control of her life in this new normal. And it's just been a beautiful thing to observe. And I can't believe that she's the only one who's kind of evolving in this way. And I'm just so impressed. These young mothers are just very, very impressive. So, I think we're kind of seeing this arc that most of us are going through, where initially there's just kind of like this disbelief that it's happening. Then this slow dawning, I was in that myself, this slow dawning of, yeah, this is like something really serious. Now, how are we going to handle this? And now we're seeing everybody adjust and adapt and come up with incredibly creative solutions. I've noticed that my social media feed has changed from a lot of disagreement and anger and all of that to now everybody is sharing funny posts and sharing inspiring stories. And I just hope and pray that we can hold on to a little bit of that once all of this is over. And I don't know, have you found that to be kind of your experience as well?
Yes. Mm-hmm. Also, if someone is feeling really anxious, what else would you suggest for them besides getting support from social media? What else can someone do who's anxious?
Well, really start asking yourself, what things do I have control over in this situation? And, we do have real choices that we can make that will enable us. Probably one of the first things is turn off the damn TV and stop watching. I mean, they have these counts going. And what I personally do is every night, I know that Butte County updates their COVID numbers in the afternoon, and I just have been checking that one time a day just to kind of see what's happening locally as far as the spread. And I'm really, as of last night, there were only 8 cases, and it's been growing very, very slowly. And to me, I think that indicates to me that, everybody's taking this seriously. Everybody seems to be, for the most part, to be doing their part. And by knowing that, I think that can bring a lot of lowering of the anxiety and comfort. And just know that I'm doing what I can do to keep myself and the people that I'm in close proximity with safe. And I just think you need to look at what I can do to take control of my situation and know that you're doing everything you can, and then let the rest of it go. Try and find out ways you can distract yourself. What fun things like I bake bread all the time now. I mean, okay, we're going to gain weight. Who the hell cares? I make cookies every day. I'm trying to do those things in between the work that, bring happiness and joy. And I check in by way of social media with my family and, kind of how's everybody doing, and everybody doing okay? Anybody need to talk? That kinds of stuff. Mm-hmm. And I guess that's about all I can say about that.
Yeah, I would probably add deep, slow, relaxed breathing, exercising. I'm doing online exercise classes that are really fun. Meditating shows lots of evidence that it reduces depression and anxiety. Those are things we can do.
Exercise is one of the single best things you can do, period, for depression, for so many different things.
Right. To go back to mental health issues, there's been a big increase in the number of people on the autism spectrum. Could you say a word about that?
Well, yeah, because it's a very personal story. But, when the DSM-5 came out, I think it's been about 10 years now, they made, it used to just be autism. And so through a lot of research, they realized that it really is a spectrum. It's on a continuum with some individuals having, absolutely devastating kinds of deficits, all the way to individuals that, on the face of things, you would never guess that they were autistic. What they're dealing with are much more internal issues kind of thing, usually of the social kind. But I personally had kind of a come to Jesus moment with my own daughter, in that I realized that I myself, even though I'm a clinician, had a very stereotypical view of what it means to be autistic. And the way in which we go about making this diagnosis, unfortunately, favors early diagnosis for boys, but not so early diagnosis for girls. And I remember when my daughter was, I think she was about 8 months old, I saw her starting to do what is known as hand flapping. And that caught my attention, and I thought, do I have a child who might be autistic? And so I really watched her carefully.
Show us what that is.
Hand flapping, like this, hand flapping. Yeah, and it's one of those very more stereotypical kinds of signs that you see in autism. So I started watching carefully, and she was incredibly shy, but I got her in preschool at a pretty early age, at 3, even though I didn't need to put her there because I was staying at home. But I wanted to see how she socialized, and initially she hung back, but she made a friend, and then she made another friend, and I thought, oh, well, she can't be autistic, and kind of put that out of my mind. And around the teenage years, we started seeing her struggle with some anxiety and all that, but I just kind of marked it off to just being a teenager and growing into your body, the whole thing that you do when you start going through puberty. And then the real problem hit when she went away to college. She basically fell apart. And that's when we started going to a series of, clinicians to get assessed and diagnosed. And she had a handful of different diagnoses. The most difficult ones to deal with was she was first diagnosed as bipolar 2 disorder. That's a kind of bipolarism where you cycle between major depression and what we call hypomania. So we don't see them having really severe manic kinds of symptoms. As a matter of fact, when they are in a hypomanic state, they often just seem like they're functioning normally because it's such a stark contrast to these depressive symptoms. And a person with bipolar 2 tends to be far more depressive most of the time than they are what we call hypomanic. And that's in contrast with a bipolar 1 where they have full-on mania, where we see these really impulsive problems where they're actually, making decisions that could harm them in the long run, even their life. But anyway, put her on medication, didn't get any better, and then we ended up finally being diagnosed with borderline personality disorder, went into I think maybe one of the best therapist practice in at least the state of California. It's right here in Chico. And she made some progress, but she just couldn't seem to get over a hump. And it was finally my daughter had a suicide attempt, and I insisted on her being admitted for further assessment. And it was Dr. Nichols at the Inlow Behavioral Health who first floated the idea of autism, and both my daughter and myself, we laughed at it and poo-pooed it, but it brought it to our consciousness. And one day, about a year and a half ago, my daughter sent me an email of an article she found about young women being diagnosed with autism, and unfortunately that's the trend. And so I read the article and I'm going, oh my God. And as I was looking at the characteristics written out in this article, it nailed her perfectly. So then I began my odyssey of trying to get her diagnosed. And I don't know if you remember the movie Terms of Endearment, where Shirley MacLaine was advocating for her daughter to get pain medication, and she's screaming and pounding on the counter there at the nursing station. That's kind of the experience I had just trying to get someone locally to diagnose my daughter, and it was impossible. The way in which, at least locally, it's diagnosed is based off of pediatrician records and school records. I had none. And they said, well, sorry, there's nothing we can do. It was so frustrating. So finally, a family member told me about UCLA Neurodevelopmental Center down there. And so I figured maybe there would be something at UCSF. So I contacted UCSF. There was a 1.5 year wait to get seen. I was able to get her in quicker at UCLA, so I took her down there last year, and they did a 3-day assessment. It's not an easy thing to go through. It was really rough, but we finally got the diagnosis. She was, in fact, autistic. She's what we call very high functioning. There are some people that take exception using the terminology of high functioning versus low functioning. I find it very useful to communicate to people that, you know, you wouldn't look at her and think she was autistic, but she has, you know, challenges that a person her age doesn't have.
Like
and
what?
Anyway,
what are
once
those
we
challenges?
No, say again.
What are those challenges?
Well, for her, and of course it varies from person to person because it is on a spectrum, they have to do with, okay, let me step back. The reason why young women slip through the cracks, so to speak, is because they engage in a behavior that's called masking. They're very good, and I personally believe it has to do with the way we know that there's a female brain and a male brain, and female brains are wired to be more relational. And so young autistic girls are able to observe how people behave socially around them, and then they mimic that behavior. But they're not connected to it. And so there's a deep sense of despair, loneliness. That's why we see a lot of depression as well as anxiety in these young women. And it's not until usually the early 20s, when they hit college, that they end up finally getting diagnosed. And so, and it's the way that it's explained to me is masking is one of the most exhausting things to do. And so it takes all their energy. And so the first, probably 8 years of my daughter's college life, she couldn't even get through a semester. It was awful. Now, post-diagnosis, and I couldn't find anybody locally to treat her, I take her down to a therapist down in Sacramento. And just since she's been working with her, she's finished her first semester, almost all A's, 4 classes, unbelievable. And she's doing really great again her second semester. We have hope now. And it was just getting the right diagnosis and finding the right therapist. And unfortunately, locally, we have a real lack in that area. I mean, I found a therapist who was willing to see her, but it costs $135 an hour, and they're basically learning on my daughter. And I thought, I'm not going to be spending $135 an hour, so you can be trained on how to work with an autistic young adult. So I found a woman down in Sacramento who has 20-plus years working with this population. And it's worth driving down there, every other week and having her work with her because the proof is in the pudding. I have hope that my daughter now will graduate from college, be able to get a job, and eventually support herself. And I don't have the time now with being a full-time, lecturer at Chico State, but one of the things I definitely have on my to-do list when I retire is I'm going to devote a certain amount of time towards trying to get more local resources built up because it's a real hole. And if I can save some parents who are struggling with their, now young adult daughters, I want to be there to be that kind of support.
So your daughter was not borderline personality disorder. She wasn't bipolar. Those were inaccurate diagnoses.
Yes, she's autistic.
Okay.
And now that we have the therapeutic support that focuses on that, she's flourishing. Now that we know exactly what kind of accommodations she needs to do well in college, she's doing well in college. And I'm telling you, Chico State has the best accessibility resource center. They are fabulous, so helpful, and it's comforting to know that if she runs into any problems with professors who don't quite understand what her special needs are, all we have to do is make a phone call and they're there to advocate for her. She doesn't have to fight the battle herself. And there's a lot of comfort and anxiety lowering that comes with that. And it frees her up to really focus on her schoolwork and do well. My daughter's brilliant. I bet you anything if I was to have her tested that she would at the very least have an IQ of a gifted person. I mean, she's a challenge when it comes to carrying on conversations about things, because she knows, heck, I'm a 63-year-old woman who has a Ph.D. I should be able to hang with my college-age daughter, and she far surpasses me. She has encyclopedic knowledge in so many different areas, you know, and I just think that whoever has the opportunity to work with her in her chosen career going forward, they're going to be fortunate employers. That's all I can say.
Does her therapist use medication and behavior changes, support systems, or what tact?
I've heard of it before. CBT, cognitive behavioral therapy, is what the therapy of choice is. And when it, you know, you can use cognitive behavioral therapy for, you know, helping people to adjust to and adapt to having a personality disorder, but you use it in a different way with a person with a personality disorder versus someone who has autism, because their needs are different. And so it's important that if a person has a young adult that's newly diagnosed with autism, that they find a therapist who knows how to use CBT for a person who has the challenges of autism. Okay?
So medications aren't useful or aren't needed?
If they're having panic attacks, there's some, you know, actually we use antidepressant medications more for anxiety disorders than we do anti-anxiety drugs, because anti-anxiety drugs tend to be more addictive, and they have a tendency to cause more impairment. But my daughter just never really responded well to the antidepressants that she was put on. But for some individuals, absolutely, that's a tool to have in the you know, tool bag.
And then what kind of accommodations help her do well in school? Like taking more time for tests or sitting in the front, or what kind of changes?
There's social challenges, right? There are social challenges that result in intense anxiety. So, for example, a speech class where you have to get up and speak in front of other people. There were some special, like when she couldn't just, you can't just throw something at her so that she would have to come off the top of her head. She requires a certain amount of preparation time to mentally prepare to get up in front of other people to talk. But boy, once there's that preparation, she'll do a speech better than anybody else in the class. Or if it comes to group work, there's difficulty, you know, reading other individuals and responding appropriately. And it adds a lot of stress. So sometimes she can do group work, but other times it causes so much stress that an individual assignment is more appropriate for her. But I have been astounded that even though she has these accommodations, she's wanted desperately to be able to still hang with the regular kids, you know, and with the help of this therapist, she's been able to do that as long as she has time to prepare. And the teacher she had was fabulous. She was actually a former student of mine, and so she was really willing to work with my daughter, and she ended up getting the top grade in the class.
Wow. What the cognitive behavioral therapy, what other kind of themes apply to a person with autism that's been useful for your daughter? She's changed her thinking about what?
I don't know that she's changed her thinking. I think she's gained a greater understanding of how best to interact with others, what she needs to be able to, what she needs to do mentally to prepare so that when she does interact with others, the anxiety component isn't there anymore, or it's at least manageable, because it used to be such a challenge that, you know, she'd end up having what we call meltdowns, and she'd end up, after having these meltdowns, she'd literally require 24 to 48 hours, we call them emotional hangovers, to recover. It's that exhausting. She would sleep like 18 hours after one day. And so we've gotten to the point where these meltdowns are almost non-existent now, because this therapist has enabled her to gain the tools that she needs. And, you know, I can only go off of what she's willing to disclose. She's a young adult. She doesn't have to talk to me about what's going on in these sessions at all. So I can only talk about it in a more general kind of standing outside watching these changes occur. So it'd be better to, you know, ask her those questions. But I can just see her managing those kinds of interactions better so that she can not have these meltdowns and then move through, complete the work that's required of her, and end up doing well in these classes.
Well, what's interesting to me is Greta Thunberg and some of the other Swedish girl climate activists are on the spectrum. And Greta says that it gives her a different kind of perspective, that it allows her to do this kind of leadership. She sees things differently. Well, how would you explain that?
I think she just did a beautiful job of explaining it herself. We who are not on the spectrum approach, it's almost like we take things for granted as to how the world works. People on the spectrum don't approach it or view it or perceive it the same way. That's not to mean that there's something necessarily, okay, I want to couch this in the right terminology. It's not a matter of good versus bad. Like, this is better than being on the spectrum, okay? As a matter of fact, I say this all the time, at least to my family members. I am grateful to have a child on the spectrum because what she brings to my world is a new way of viewing and seeing things. And I enjoy that so much. Put it this way, what my daughter brings to my world is a depth of understanding that I would never have gotten if I didn't have her. So as you just described Greta's experience, it is the exact same thing that I see with my own daughter. They bring a depth of understanding in a way that maybe the average person would just take things for granted. It's more surface. There's a depth that she goes to. Like when she takes on a project, or she gets fixated on different topics all the time. For example, she went through a period where she was fascinated with anything space related. She would stream the space station. They have 24/7 streaming through NASA. She would go and read articles. I mean, she could carry on a full-on discussion with anybody about the topic of space. The average person doesn't do that. And so I'm constantly learning from her because I don't have the patience to sit there and do that. But that's something that drives her. So I think these individuals bring to the world something really special, and it shouldn't be discounted just because they approach the world in a different way. You see what I'm saying?
Yes. So they're able to immerse themselves in a topic in a way that those of us who are more distractible don't. And any other...
Exactly. You said right.
Any other ways that your daughter thinks differently because she's on the spectrum so that we can understand how their brains work?
Again, I think you'd have to ask, I think those are questions that are better asked of individuals who are actually experiencing it. I don't want to speak for her. All I can do is share how I experience her, and I experience her in this very, there are times when she awes me. I sit back and I watch her, and I go, how could you have even come from me? You are I mean, she is so much more than I would ever hope to be. And it's because of her diagnosis that she is this special. And I'm not using the term special in a pejorative way because we know that has become kind of a buzzword for, oh, they're special. No, I mean this in every way that that word special is implied. My daughter is a level above me. There's something so awesome about her that I don't think I would have received what I've received from her if I had had a daughter who wasn't on the spectrum.
Is there some reason that there are so many more young people being diagnosed? Is it because of some environmental factor, or just that we're aware of it so they get diagnosed? But there's this big increase. Why?
I think it's because we are diagnosing it more because we know what it is. You know, before we didn't know what we were looking at, okay? So that's number one. We now know how to identify and say, yeah, that's that. But, of course, there's those who are the anti-vaxxers who say it's because of the vaccination schedule. Unfortunately, that particular researcher, he's British, he falsified data, and that kind of ruined it for research in that area, if you know what I mean. People who cheat, they sometimes tend to wreck it for the rest of us. But we do know that the neural circuitry in the brain is slightly different. I'm sorry, but I have to believe that there are some environmental factors. What they are, I don't know. I also believe that there's also genetics. I know that there are some other members of our family that have been diagnosed with autism. I'm just starting to find that out. And so I do believe there's a genetic factor there as well. So it's a combination of things, just like it is true for most things. So it's a combination between environmental, the whole nature and nurture
Right.
contributing.
Why isn't the term Asperger's syndrome used anymore? It changed to spectrum.
Oh, no, and it pisses me off because the lay public understands the term Asperger's. It's been handled in, dramatic, fictionalized kind of accounts on television. People can see it. And so now we're kind of left with this, distinction between high functioning and low functioning. And it's my understanding that some people with autism don't like the term high functioning, low functioning. My daughter and I tend to use it because it conveys something like, it conveys that, she's still really smart. She just has some social deficits kind of a thing. But I just saw a YouTube video of a young woman who was diagnosed at 15, and she just did this whole, rant kind of about, that's just, there's no high functioning, low functioning. So there's a bit of disagreement among the autism community. I just think that if they would just call Asperger's still Asperger's, it would clear up a lot of confusion.
Well, there are some autistic kids who can't speak. I mean, they can't communicate with words. So, yeah. I mean, that's low functioning.
Exactly. So, but I just wish they hadn't eliminated it. But the idea behind it was that, it is on a spectrum, and so people who were previously diagnosed with Asperger's are just on one higher end on the spectrum. And so everybody should be on the spectrum. I just wish they hadn't eliminated the term.
I'm really interested in generations, and I'm wondering why there's increasing number of, especially girls, but teenagers diagnosed with anxiety and depression. It's been a big increase recently. Any ideas why?
Yeah, I think some of them might be autistic. Since we had this diagnosis, and I talked, my daughter allows me to talk freely about it in general, and I've had 3 different young women come up to me, tears in their eyes, saying, "I think that might be me." So because I could look it up, but I didn't look up the rates prior to talking to you, but I believe that there's significantly more boys diagnosed with autism than girls, and I do believe that there are many more young women who are autistic. Now, okay, not all of the women who are feeling anxiety and depression are autistic, but I think there's probably a small subset of young women that that's just a misdiagnosis. But as we look at the changing nature of the world, being much more information technology focused, there's also been, and I don't know, I see a lot of young men awfully anxious too and depressed. But there are more young ladies, but there's still a lot of young men who are anxious and depressed as well. I've had my share of students who have, disclosed to me and have been diagnosed and need accommodations and all that. I think that there's a lot of pressure on young people. I think there's an information overload. I think that there are sometimes expectations that are placed upon our young people that, you have to go to college. And I can't tell you how many times I've had students come to my office hours and it's clear to me that they have interests other than getting a college degree, but they're there because their parents say they have to. And I just think we've sold a bill of goods that, a college education is absolutely necessary to be successful in life, to the detriment of more trade kinds of jobs we still need people to do trade jobs. They're very respectable. They earn good money. And I just think there's been a lot of unnecessary pressures placed on our young people. And it's coming out in the form of depression and anxiety. And those two often go hand in hand.
Right.
Because, the anxiety is kind of a precursor. Then when you slowly start, kind of falling apart and having impairment, then you start having a depressed mood kind of a thing. And I just think that there's the changing nature of the world and unrealistic expectations all kind of make a perfect storm. And there we have, anxious and depressed young people.
Right. I think pressure is really the key word. They have so many pressures on them. I'm wrapping up here. What have you seen any changes from Generation Y students to Generation Z? Zs are now, the oldest ones are 23. And you've seen any generational differences in your students?
What I've seen, and these labels just are kind of funny to me. We're just all people trying to find our way through the world. And yes, this younger generation have different pressures on them from when myself, a baby boomer, was their age. But, again, I experience these people young people on a daily basis. And what I have noticed most is, I don't want to give them a bad rap, but there's a sense of entitlement that wasn't there 10 years ago. There's this notion that if I just showed up, I should be able to get a good grade. There's also a lack of care about completing tasks the way in which they've been instructed to do so. And then when I hold them to that standard, there's a level of kind of backlash anger I get, a lot of disrespect. There's not a level of, it doesn't seem to be, okay, I'm starting to outline all of these negative aspects that I experience. But I just think, I'm sure you remember the term generation gap. I approach the world differently than these young people. And where I experience these as negative aspects, what I've found, I'm changing myself in the way in which I react and respond to them. Instead of getting pissed off and angry all the time, I'm trying to come at them from a different point of understanding where they're coming from, but still holding the line as far as what I have as a standard. And I found that I get much better response now from my students. So I rather than trying to dissect them and judge them, I've just been trying to understand them. But their way of approaching the world is very different from the way I approach the world. And I've been working at bridging that gap.
Well, if they feel entitled and they don't have to do work, you understand that they feel they don't have to do work, but there has to be consequences, right?
Exactly. That's why I tell them at the very beginning of the semester, I'm a behaviorist, and if you don't know what that means, I'll tell you very simply. you choose the behavior, you choose the consequence that comes with it. And I'm a person that has very clear expectations, very clear requirements. And if you don't follow the instructions and you don't give me exactly what I asked for, you're not going to get a good grade. So you may think you know how to do it better than me. You may think you have a better system than me, but I'm the teacher. And if you follow my system, trust me, you're going to learn something, number one, and number two, you're going to do really well. But if you want a bucket, that's your choice, but this will be the consequence. And they find out quickly that I follow through. And I don't know, I seem to have a pretty good relationship with most of my students.
Mm-hmm.
I hear my pretty good relationship. I don't know.
Is there anything else that you'd like to add about understanding current mental health issues that you want to make sure we discuss?
Well, as I've already expressed to you, my heart is heavy for these young women that have slipped through the net, so to speak. And if my spending a little bit of time with you brings an awareness to the general public so that maybe they can notice something, say something, and maybe lovingly guide towards getting assessed, that would make me happy. Also, making clinicians aware of this gap, of this absence of being aware and assessing these young women, then again, that would make my day. That's my whole reason for agreeing to talk with you today, because it's something that needs to be heralded and heard by both lay public and clinicians alike. There are young women out there suffering, and they need to be diagnosed, and they need to have support so that they can succeed, because these are the most amazing and awesome young ladies, and I want them to be able to experience as full a life as anybody else.
Great.
So that's what I want to leave